which is Chinea Nwadikski-Feshuba, is a criminologist and a lecturer in the Faculty of Social Sciences, Department of Sociology at Nnamdi Azikiwe University in Nigeria. She is joining us on behalf of the Center for Innovation and Pragmatic Development Initiative in Nigeria, also known as CIPDI, which is an organization that deploys customized, innovative approaches to solve problems, build communities, develop and equip individuals to transform their environment and circumstances. CIPDI is currently working with several secondary schools in Nigeria to develop drug awareness programs. So today, Chinea will be speaking about the significant role of civil society organizations in the effective functioning of social systems, and will provide some practical examples of the many critical roles that civil society organizations have played in managing societal challenges. So Chinea, you have the floor. Thank you so much for joining us today.
Thank you very much, Mariella. I hope I'm pronouncing that properly. Thank you very much, Jamie, the organizers of this forum. And thank you to the panelists, the speakers. Thank you, Stacy. Thank you, Ernesto. And thank you to all our guests participated in this today. It's good afternoon here in Nigeria. Good afternoon. As Mariella already introduced me, I will be representing Center for Innovation and Pragmatic Development Initiative. I would like to join the current discourse, which is on the central role of civil society in drug policies, COVID-19 pandemic, and achieving the 2030 agenda. It's important for us to note that the role of civil society in the effective functioning of the social system cannot be overemphasized. That being said, in Nigeria here, it's important for us to note that the civil society are regarded as the watchdog of the society. They perform both manifest and latent function, such as providing specialized information, they provide advice, they engage in lobbying efforts in order to ensure public accountability, in order to ensure sustenance of social order, in order to ensure social development. And they do this through various forms of media outlets. That being said, however, the role of civil society organization in drug policy in Nigeria has not gained the significant recognition it needs, especially in this extant day. That being said, hence, this singular fact undermines the critical role that civil organizations, civil society can play in terms of helping the Global Health Organization combat the challenges that are facing drug policy, especially within the ambit of international joint drug law policy, which is committed to prevention of drug abuse, treatment of drug misuse disorder, they control the access and accessibility to these substances. Like in Nigeria, we have a lot of young people abuse illicit drug that is known as tramadol. And there's another drug that is known as codeine. It's actually illicit, but the way they abuse it, it's now considered an illicit drug. So before you get it in Nigeria now, you need to get the proper prescription for it so that they will make sure you're not abusing this drug. And that being said, this international joint drug policy, they also involve in stuff like law enforcement, especially when it comes to drug-related crimes. They also are involved in drug and the human rights issues. That being said, there is this singular assumption that most people have that it is exclusively the duty of global health organizations to coordinate, and it's their responsibility to coordinate everything that has to do with drug policy and administration. But I will give an instance in Nigeria where to show the critical role that civil society can play in drug administration and drug policy. In Nigeria, during the COVID-19 period, it wasn't very easy for the government to reach everywhere. So it was the civil society that was able to reach those places the government could not reach. They were able to provide nose masks, face masks. They were able to provide hand sanitizers. They were able to provide hand gloves. They cleaned up public places. They provide waste baskets to make sure that they curtail the spread of this COVID-19 virus at its peak in Nigeria. They were also able to go to rural places, to the marketplaces, talk to rural women, talk to the youths, because it became a problem between security agency trying to enforce the guidelines for COVID-19. Most people started rebelling, and it became violent between the law enforcement agencies and the youths and the general public. So this civil society came in to make sure that they sustained this social order by enlightening the public the importance of them cooperating with the government in order to curtail the spread of this COVID-19. Because in Nigeria here, most people believe, because we have a lot of corruption issues going on, that it might have to do with that. It's not really what they say. But with the help of this civil society, people start understanding that it's actually for everyone's good that we adhere to the guidelines that are provided. Having given this instance to highlight the important role the civil society played, and during the COVID-19 period, we have issues of young people, a lot of poor families that work and eat daily. They call them daily pay minimum. They perform this minimum level. So without them working daily, they can't feed. So most of them got depressed and frustrated, and they were involved in all sorts of drugs in order to help them cope with the whole COVID-19 effects. So the civil society have been trying after them to try to curtail the effects that this COVID-19 has brought. It has made more youth in Nigeria to be involved in drug abuse of different forms, not just the youth. Sometimes you find even frustrated families that get very much involved in this drug use. So if this could be replicated in terms of the collaboration of civil society and World Health and the global health organizations, if they can reflect this, it will show the critical role that civil society can perform in order to help attain the objective of the Sustainable Development Goals, like the number 3, which is good health and well-being, as well as number 16, which is peace, justice, and strong institution. So that being said, I want to go ahead and state some of the recommendations I have. One, there is need to improve the viability of this civil society in Nigeria. They can do this through collaboration of through collaborative socio-economic programs. They can do this by government investing or financially aiding civil society, as well as they could even give more responsibilities to the civil society so that they can function effectively. Then the number 2 recommendation I have is it is important. There is need for civil society to liaise and work with security organizations. For example, in Nigeria, we have the Nigerian Drug Law Enforcement Agency. They can collaborate with them. They can collaborate with the Nigerian Police Force as well. They can collaborate with the Nigerian Immigration Services. And if this is done, I think it will profile the needed solution to this issue at hand. So I want to keep it brief and short. Thank you very much, everyone, for listening.
Thank you so much, Shania, for your excellent remarks. So useful. I really appreciate you highlighting truly the need and the importance of civil society engagement, this idea that civil society is on the ground, has access to spaces that policymakers, international organizations, those researchers, folks that we can sometimes think about as